So I want to think about the blood circulation in the womb. And one reason I want to think about this is because often we're very afraid to use blood-moving herbs in pregnant women. And I think that's because we have a misconception about the nature of blood-moving herbs and how to use them properly. And in my experience, the proper use of blood-moving herbs during pregnancy can save a pregnancy. It can save a threatened miscarriage, can help prevent a woman from having habitual miscarriage. So what we want to think about in terms of the quality of the blood in the womb is just think of all these blood vessels that surround and wrap the womb. And really, this picture that I have here is really, it doesn't really show anything compared to how richly supplied the uterus is with blood vessels. It's sort of very sketchy kind of picture. It's just so much richer than this. And so if we think of these little capillaries and vessels that are infiltrating and surrounding the womb, we think that the blood is kind of thick or it's kind of cold, then we can see that the uterus is not going to get its moisture, and it's also not going to be oxygenated well, and that could be a problem. So we want to start thinking of blood-moving herbs as herbs that improve the quality, that we can use blood-moving herbs to improve the quality of circulation to the womb. And we don't want to only think of blood-moving herbs as sort of purgative, like there's some block and we're using blood-moving herbs to push that block through. We're kind of moving a boulder out of a river stream or something. There are really skillful ways to work with blood-moving herbs so that we're just improving the quality of blood and improving the circulation and oxygenation of the womb. So we want to look at that when we get to the treatment part of it. Okay, so next we're going to talk about the diagnosis of blood problems. And first we're going to look at blood deficiency. And these are the signs that tell you for sure that there's blood deficiency, but they don't tell you the root of the blood deficiency. Like, is it kidney yin or yang deficiency? Is it spleen qi deficiency? But when there's a pale, thin tongue body or pale or orange sides of the tongue, this is for sure a blood deficiency. Also, if the patient has a sallow complexion, which means like no redness, no rosiness, pale lips or gums or under the eyelids. Weak fingernails is also, for me, a for sure sign of blood deficiency. And also if there are general deficiency signs with a scanty or late menstruation. Of course, all scanty and late menstruation is not due to blood deficiency, but if there's a general deficiency type person with scanty or late menstruation, then I know that deficiency, at least in part, helps explain why the periods are scanty or late. Okay, now we're going to look at the diagnosis of blood stasis, and this is going to be a little bit more involved than what we think about when we learned about blood stasis in school. Of course, all these signs tell you for sure that there's blood stasis, but they don't tell you the root of the blood stasis. So other signs and symptoms are going to tell you the root of the blood stasis. So first of all, we have fixed sharp stabbing pains, which are worse for pressure. Fixed painful, irregular, or hard masses and lumps with discolored or dark overlying tissue, for sure blood stasis. Darkish mottled complexion, purple or brownish discoloration of the skin, including skin tags and moles. Now here I would have a caveat that not all moles and skin tags, if you have one or two moles or skin tags, it's not very serious blood stasis, but some people develop a lot of them, and sometimes, in a year somebody can develop, 20 moles, and so then we would diagnose that as blood stasis. Purplish dark spots, coloration, or broken blood vessels in the sclera and conjunctiva. So we can look at people's eyes. The tongue is darkish or purple with brown or purplish petechial spots. Darkness of the lips and gums. The sublingual veins beneath the tongue are distended and dark. Also a choppy or irregular pulse. Now I know that there's some controversy. First of all, what is a choppy pulse? So for me, what I'm describing here as a choppy pulse is a pulse in which the rhythm is not even. and also where I happen to feel the pulse changes. So it might be the pulse might come up high, and the next beat it comes a little lower, a little weaker, a little stronger, irregular. It doesn't come on with an even strength and in the same place every time. And also the rhythm, it's not necessarily missing a beat, but the rhythm is an uneven rhythm. So that's what I'm calling a choppy pulse here. There are other definitions of choppy pulse. Um, and for me, when I feel that kind of pulse, I think there's blood stasis. Um, now, we'll get into a little bit more how you treat blood stasis, which actually isn't always with blood-moving herbs. Um, but for my practice, this is how I define it, and also this is how I interpret a choppy pulse. Vascular abnormalities like petechia, spider nevi, caput medusae, which is sort of a purplish lump that can develop, varicosities, angiomas, which are purplish, dark, or raised or flat, purplish nails, thickened or deformed nails, darkish or mottled or spotted palms and hands like age spots, blood stasis diagnostic signs on the abdomen, which we will get into exactly what those are.